Hi, how are you today? Good. Okay, we'll start off with patient number 1. So in room number 117, we have a 65-year-old male who was brought to the ER by his wife with complaints of severe abdominal pain, nausea, and vomiting. He states last Friday he came to the ER with complaints of abdominal pain, and they sent him with a laxative cleanse, and then they sent him home. He then presented back to the ER a few days later with complaints of severe abdominal pain. And he states he has a history of colon cancer, a paralytic ileus, partial colon resection back in 2014. He was admitted to the floor with a complete intestinal obstruction. The patient is a full code, and he has no known drug allergies. On assessment, we found a very firm distended abdomen. He lets me do slight palpation. He will not let me do deeper palpation due to abdominal pain. He states his last BM was on Tuesday, October 2nd, which consisted of diarrhea. No blood noted, he said. He had hypoactive bowel sounds in all 4 quadrants. He stated he hasn't passed any gas since he's been here. He's stating his pain level as at a 9 on the pain scale. Doesn't really get any better. It gets a little bit better with the Dilaudid that we administer, which is Q4 hours, and he takes it around the clock. So I would go ahead and just give it when it's time, every 4 hours, because he's in severe pain. He's currently NPO. He has a NG tube inserted with intermittent nasogastric suctioning. We have provided a few 30 ml flushes throughout the day because that tube has kind of slowed down and the gastric contents haven't been coming out very well. We did have to reposition him. We thought maybe the tip of the tube was maybe pushing against the abdominal wall. So we had the RN come in, and she administered a little bit of air in there along with the flushes. We seen that the NG tube started flowing a little bit better. So he has had a total of 450 mLs out of the NG section. Let's see, the contents are green-brown. He also has an IV infusing in the left and a cubital with it's infusing at 150 mLs per hour of normal saline. We checked his BUN and creatinine. Those were both high because we've been monitoring his eyes and nose, and he has only had 3,773 milliliters of output and 3,773 milliliters out in, and 1,350 milliliters out. So we did notify the doctor who wanted us to perform a bladder scan. So we did the bladder scan, and we noticed a post-void residual of 96 milliliters. So we notified the doctor. He wants us to continue the normal saline infusion until further notice. The patient is allowed to have ice chips, which he's been asking for throughout the day. He also grabs a cup of water, rinses his mouth out for his dry mouth, and spits it back out. We also have been monitoring his blood sugar levels, which has been ranging between the 150s and the 170s. His activity orders are up with the cyst. He has been ambulating in the hallway. We've been following him with a gait belt. He does pretty good. He does get a little bit shortness of breath, and he has experienced some abdominal pain, so we've just kind of been standing right there next to him. But he does pretty good. He did say he has been a smoker for 25 years, and he has quit for 4 years. He does have a wife and 2 stepsons. The wife hasn't been here since I've been here, but he said that she has been keeping the boys company at home because they're down to visit from college. So she hasn't been here, but they've been communicating with each other through the phone. He did have a surgery consult in which the doctor noted that we will continue to monitor his progression over the next few days, and if he doesn't get better and he continues to decline, he's probably going to have surgery. But the good news is since yesterday, his abdomen has become less distended, and hopefully it continues to improve. That way we won't have to do surgery. He also has diazepam, which we administered yesterday for anxiety. He hasn't taken any today. He seems better today. We also gave him Pepsid at 1,300 for upset stomach through the IV. It was 20 milligrams. And he also has promethazine ordered. We haven't given him any today. He hasn't complained of any nausea. And I think that is all. Do you have any questions for me? No? Alrighty, well, hopefully he continues to improve. I hope you have a good day.